My name is Dr Stoleworthy. I'm an emergency physician. I'm residency trained and board certified. And I've been at Logan Regional Hospital since 2002. I'm currently the medical director of the emergency department and have done that for over a decade. So Baine came to us a little over a year ago, and Baine presented basically very similar to a lot of kids or adults that have stomach flu. He had been sick for a few days. He checked in. He was sleepy, but we could arouse him. He would occasionally follow commands. He just wanted to sleep. He was dehydrated clinically. We were able to get him to do a couple of purposeful things, and so we thought, with his history of the vomiting and nausea and stomach flu symptoms, we thought, well, let's hydrate him, let's do some labs. We see a lot of children like that. You give them IV fluids and they perk up and they do really well. And he didn't look too overly ill at the time. His vital signs were fairly normal, and so we started that process. We got some fluids in, and we reassessed him after we got his labs, and his labs weren't really that helpful. We rechecked him. This was about a little over an hour into it, and he was still the same way. As a matter of fact, he seemed to be a little bit more sleepy. So being concerned about this with his mental status, we were worried that maybe he had had one of the viruses, like the enterovirus or other things that can cause a stomach flu and actually become like meningitis and start affecting the brain. So he didn't have any of the typical findings for that, but he obviously wasn't improving. So we hurried and did a lumbar puncture and got that sent, and we started him on antibiotics as a precaution early and got those pretty quick, and they were totally normal. So that's when I knew, because by that time Baine really wasn't improving at all. That's when I knew Baine had something not common. At the time, his family didn't know the condition, what was in their family history genetically. And whenever you have mental status issues like Baine had, I talked to Primary Children's. I said, we need your help. They accepted him. We moved him up to a front room just to make sure in case anything worsened. Nothing did worsen. And so he started becoming lethargic at this time. We didn't give him we gave him the standard dosings of IV fluids and talked to their specialists, and they were like, yes, please transfer him down to the emergency department. At that time, I thought, I need to get an ammonia level and a couple of other things since things were not making sense or panning out, and we shipped him. Obviously, we're a hospital that's can take care of the community in most ways, but with pediatrics, we need the specialty expertise of pediatrics and primary children. So it was great to be able to have a relationship with them and expedite his transfer down there. It's still hard though. Man, it's hard, because one of the things, you can do everything right, and the nature of the job that I have, you can do everything right and still not fix the problem, identify the problem fast enough, even though you're doing your best to try to do that. It's hard. And it's like with most patients now that come in and they're altered, I get an ammonia level pretty quick. Unless it's really obvious it's something else, but hyperammonemia in young is not that common. And usually it happens with people that have known deficiencies. So they have a metabolic disorder, and the family says, hey, my child has a metabolic disorder, and I'm really worried because they're getting sleepier or they're acting a little bit different. Will you check an ammonia level? So you get prompted from the get-go. So now with me, ever since Baine, I get it on all my patients, just to expedite the process, cut out maybe 90 minutes here, 2 hours there to try to identify it. And it's challenging, but it's definitely something that has changed the way I practice. And with our group, one of the things that we've we've gone over this case with the group, the 8 physicians that I work with, and then the 5 extenders, the physician assistants and nurse practitioners. We've gone over this case, and now we're going to go over it again and identify and train both our nurses and our staff and all of the providers to try to think ammonia levels from the get-go. And that's more than anything what I hope, from our end we can do. But more than anything, the best help that we can get is families. If they're recognizing some type of condition where people are dying suddenly and there's kind of all these vague explanations for it, genetic testing to try to figure out what it is.